Now we return to the state of North Carolina for the Smart Start program, represented here by Ashley Thrift and Stephanie Fanhoul.
Fanhoul.
Okay.
Thank you. Smart Start is a bold new way to change the future for North Carolina's children. And this particular innovation is not a program, but rather a major overhaul of our system. Now, we admit that in North Carolina we certainly did have need for a little overhaul. We certainly had our share of rotten outcomes, as Lee said yesterday. But we also had a governor who was not satisfied, and a governor who expected much more of us. And so what he did was set a broad goal that focused down for the solutions at a local level. He expected the local communities to identify the barriers for reaching the goal. The goal, every child under 5, healthy and ready to go to school. He expected them to figure out the solutions in their local communities, and then he empowered them to make up the answers. So their solutions were the solutions that fit their problems at this time in their community. We provided significant state dollars for every county, and then we held each county responsible for the outcomes. And then as an aside, of course, he expected everyone, absolutely everyone, to be involved in the process. He enlisted nonprofits, the faith community, business members, the university system, the school system, and every state agency that worked, that lives and breathes in the state of North Carolina. And it worked. The first year, 98 of our 100 counties applied to be in the first cohort for Smart Start. The energy, the creativity, and the passion just poured out of the counties as they worked on their solutions and were convinced that their own solutions were going to solve this big problem. But as you can imagine, it was just a little messy. It continues to be just a little messy. And it takes a long time, much more time than any of us expected. But it still works. And we stand here today, probably a day or two away from our final budget for last year, by the way, from our General Assembly, that will expand Smart Start to all 100 of our counties. And it's messy there, and we promise it will continue to be messy as local folks struggle and wrestle with the issues that live in their communities. The results are pretty impressive. We have aggregate numbers. We can tell you that 100,000 children received child care subsidy because of Smart Start. That's in addition to our child care development money and our TANF transfer money. We can tell you that thousands upon thousands of children are in classrooms where their teachers now have post-secondary education that we never had before. We can tell you that close to 100,000 children received a pre-health screening or a special screening for their hearing or vision. We can tell you all those numbers. And we have a massive evaluation that's wrestling with the issue of when you let them make their own solutions, how do you test which one works when there's so many solutions to so many local problems? But on a state level, I wanted to share two things that I think indicate that it has shifted, indicate that the root of the system is now challenged. And one is the fact that in a recent legislative hearing, the Standards & Poor's specialist coming to talk about our bond rating talked about our major investments and what they expected the state to spend money on in the next several years. They talked about the university system, the roads, the community colleges, and they talked about Smart Start. I'm going to move and let Ashley Thrift, our volunteer chairman of the North Carolina Partnership for Children, talk also about the kind of energy that's come from our private sector.
Thank you, Stephanie. In a word, private sector support for Smart Start has been dazzling. Since our beginning, over $30 million has been contributed and nearly 1 million volunteer hours. Let me tell you that when the major banks of your state provide the largest individual gift they've ever provided in their history, and these are people that make investments for a living, When that happens, people take notice. With this kind of validation, Smart Start has soared. The public recognition and trust gained is a currency that is highly valuable at our General Assembly. Because of a resolute governor, state and local bureaucracies willing to think anew, and a private sector willing to collaborate and partner with government, we're meeting our challenges for our children head on. The good thing is, with Smart Start, we're winning.
Thank you. David Osborne.
The goal, as I understand it, is children ready to learn when they start school. Do you have data comparing, say, take your phase one counties, comparing them to others that were not in phase one that would indicate an improvement in that outcome?
We do. Understanding, of course, we're in our 5th year, so we are just at the beginning of collecting that data. We have 2 particular counties that we focused on, both relatively urban counties, who are showing that, in fact, the children are showing up at kindergarten as based on the kindergarten assessment of their teacher's assessment of their skills at a significantly in a significantly better place than those who may not have had the experience of being in a program that receives Smart Start enhancement funds. We also have an anecdotal record, a story we tell frequently about one of our counties that claims that the children are more prepared because this year is the first year the kindergarten teachers report that all of the kindergartners showed up and they were all toilet trained.
Yeah. To go back to your, if I can just follow up on that briefly, your application cited that same study and used that same language about significantly better. Was there any quantification?
The one quantification I do know, in Mecklenburg County, where they tested, 19% of the children coming to school were deemed not ready to start the kindergarten program when we started. Now, about 4 years later, that study was done again, it's 14%. Charlotte's a dramatic community with a lot of people in migration, a lot of change, but we believe very strongly that we've had an impact on that number. I can't tell you what that percentage would be.
Please, for a lot of questions here. Please.
I want to explore for a minute the question of how much help you give centrally to the local communities. You have decided as a matter of principle that they should have a lot of freedom as long as they're reaching outcomes. Is the reason that you don't provide more technical assistance and more of the answers that have been found elsewhere to the local communities a lack of resources, or is that also a matter of principle?
I think it's a little bit of both. Certainly there, as we collect information about what works better, we regularly have large meetings, small meetings, and group sharing time, both electronically and in person, between the partnerships where we talk about what has worked here and has not worked there. So in that regard, we've been able to do that, and that's not a violation of our principle. But on the other hand, it is difficult to cover 100 counties all tackling slightly different problems and be able to have enough staff out there, which we don't have a lot of staff to do that kind of work. So it's a combination.
Bill Klinger.
Following up on that, there's some suggestion in the material that a weakness of the program is that the local capacity to really carry out the purpose of the program is lacking in some areas, and that is inhibiting your ability to really develop the program. Is that a justifiable criticism?
No, I don't believe it is, and I'll tell you why. I think part of it is fiscal. But one of the things we want to do with Smart Start is build quality and capacity, both in children, families, and communities, to solve these problems. We don't just put them out there with no program. We have a core services effort that we put underway. We invest a lot in technical services to try to build that cadre of people. But we bring together a lot of existing bureaucracies that are already very capable people. What we require that they do is they operate in ways that they haven't thought before, with a synergism focused and targeted on children at critical times of their development. That is not easy when you have a county like Charlotte, Mecklenburg County, which is huge and has great resources, and Jones County with 8,000 residents and not even a doctor. You have to take the opportunity where it exists, but we're going to move them to a quality and a capacity that's going to serve every child in our state.
Jack?
Last year we honored a Georgia pre-K program statewide. Sounds somewhat similar to yours. How do you distinguish yours from theirs?
There's a significant difference, I believe. A Smart Start is focused on all of the needs for the children, including health needs. Also includes a pretty serious component to parent outreach and parent support, whereas the Georgia program is only focused on early childhood programs. And those programs are established through a centralized location rather than our programs that are coming up from the grassroots. So while we will receive some of the same outcomes based on improving quality in child care, ours is a much broader base than the Georgia program does.